Hi, my name is Michael Harold and I work with Professor Peter Gibbs at the Walter and Eliza Hall Institute of Medical Research, or WCMICS. During this talk, I will introduce you to the Care Plan project and how it can benefit patients and health services. Firstly, I'll give you an overview of the Care Plan project, focusing on the reasons we initiated the project and the benefits for patients and GPs. In the second half of my talk, I will give you a brief overview of how we achieved a successful outcome in delivering these benefits, with a few bumps along the way. So comprehensive patient clinical data related to diagnosis, staging, treatment and follow-up is currently collected for every patient with colorectal cancer at Western Health. This data registry is called ACCORD, the Australian Comprehensive Cancer Outcomes and Research Database, and the data is primarily used for audit and research purposes. Patients are seen in clinic by a medical oncologist and their diagnosis, treatment options and investigations are reviewed. An initial treatment plan is agreed upon, which may include adjuvant chemotherapy, and a follow-up schedule for the next 5 years is discussed. Patients presenting to the clinic are often quite distressed, and the large amount of information that is presented to them is difficult to retain. Also, specialist communication with the patient's GP by form of a letter may not provide all the required detail about the patients. So our initial proposal was to use an existing data resource, ACCORD, and from this generate a personalised care plan to give to patients. So why did we initiate this project? As I said, we felt we could better utilise our data registry to not only capture data for research and audit, but to better inform patients and GPs of planned treatment and follow-up. The care plan concept gave us an opportunity to expand our registry to become a tool in the clinic. And this is in line with our own objectives of using data capture to support routine clinical practice or new concepts in registry-based trials, an area that the lab's been working on over the past few years. The care plan template would be created as a module of the existing database and would pull out specific pieces of data that had been entered for the patient, such as date of surgery, staging and treatment regimen. Patients may receive general reading material related to their disease or planned treatment, but they do not receive any personalised written summary related to a lot of the information they have told to them in the clinic. This general communication has always been an important part of an oncologist's interaction with a cancer patient. However, we know how overwhelming all the extra information given verbally can be at the time of initial diagnosis. And this is at a time when the patient is usually in a very distressed state. So this opportunity allowed us to create the missing piece of information that we were confident would enhance the patient experience. What are the benefits to patients and health services? The patient aimed to be able to provide patients with a documented summary of what has been told to them in the clinic that would improve communication with patients that they can refer back to over time. We felt that a personalised care plan would be more meaningful to the patient than just the general reading material and more likely to be of value in the future. Patients would benefit by having their personalised treatment and actual follow-up schedule within a relatively simple one-page summary document that a patient could take away and more likely refer back to over time. And importantly, patients would also know which month their next visit is due and if a booking is missed at the hospital. They can then contact the hospital and ensure they are booked in for an appointment. The key general information that would be found in booklets is also included in contact details for the CERT clinic, which is the symptoms and urgent review clinic, and an info for after-hours emergency is also included. A secondary aim of the project was to improve the communication of this patient information with GPs. The care plan has been sent to GPs' rooms as additional information to the consultant clinic letter. A better informed GP about the patient's plan in a simple summary would be helpful in tracking where a patient was in their care and follow-up. We feel that these aims are addressing issues of better communication with patients in the colorectal cancer optimal care pathway and addressing areas of the Victorian Care Plan through improving the patient's experience of care and provision of information. Once refined, we anticipate this could be utilised for other tumour types and at other hospitals, especially our ACCORD partners. We believe there is much scope for this to be rolled out to a wider cancer community and benefit many patients. So now we move to the second part of my talk today, the electronic care plan in action. So once we realised that Accord wasn't going to be a feasible option, we turned to the RedCap solution to deliver the care plan. So here is an example of the care plan report form built in RedCap. The key data that will be extracted to populate the template are patient name, date of birth, GP's name, and date of surgery. These data items will be inserted into the care plan template. Date for calculations will usually be the start date of chemotherapy, but can be adjusted if there is a delay so that the follow-up schedule will be correct for month and year. There are care plan templates for different treatment durations, such as 6 months or 3 months, and they can be downloaded to print or save. So further down on the care plan report form is further key data to be captured: staging information, treatment duration. For example, treatment duration, there are multiple options to select from as there are different treatments and different durations. And the appointment times are calculated and displayed as clinic visits on the care plan for up to 5 years. Here is an example of the actual care plan that has been generated as output from the report form. Most of the text is already in the template. There is important generic information about their cancer, the cancer stage and treatment. The key data that has been entered into the report form has been automatically inserted into the care plan, and this data is shown in bold. So this is the 5-year follow-up schedule that shows approximate clinic dates with just the month and the year displayed. This patient has started their treatment in October and will have treatment visits for 6 months. Treatment will be completed in April and the patient will commence their follow-up visits in July. They will continue to have 3 monthly visits until 2 years out from surgery, and then from 2 to 5 years they'll have 6 monthly visits. So further objectives of the study were to evaluate and analyse patient and GP satisfaction and value of the care plan through surveys. So far, the feedback from patients has been very positive as expected, and we are still in the process of gathering feedback from GPs. Patients have been asked to complete surveys at different stages post receiving the care plan. Some have received during treatment and some have received after completing treatment. So we've found that the latter to be more meaningful feedback about the value of the follow-up schedule, as patients pretty much know what's happening during their treatment, and it's that time after they've finished treatment, and just knowing and having that schedule about their follow-up over a period of many years, we thought would be really crucial to get feedback about, and whether they were actually following that schedule, and also whether the month and year that were in the schedule were actually accurate. So there have been a number of challenges this year, as with everything. Once COVID arrived in March, there was a substantial decrease in eligible stage 3 patients for the project. Elective colorectal surgeries were postponed and patient clinic visits reduced markedly. Once telehealth appointments were introduced, we had to change from conducting surveys in clinic to mailing out surveys to patients. And unfortunately, this meant that some would not be returned. Our other issue was GP clinics were busy managing the new COVID environment, and completing surveys about information became a low priority. In summary, there have been some challenges in implementation of the project, but we've been able to deliver the care plan to patients, and they can only benefit from having improved communication and information about their diagnosis and treatment and follow-up available. And also just to refer back to, really crucial, I think, with this particular project. The plan is still to build the care plan tool into the Accord redevelopment, and we think it can only be better for the new ideas and issues that have come up along the way using RedCap. Once this has been achieved in the new year, we'll be looking to deliver the care plan to all our colorectal cancer patients and then to other Accord sites and beyond. Thanks very much. And any questions?